Good evening, everyone. Welcome once again to another episode of our um, presentation tonight, hosted by Yahweh Kingdom Lifestyle Ministry. And really appreciate everything that Yah has done for us, for me, in my life, getting closer to you all at least once a week and presenting to you some very valuable tips. I could say that it's indeed blessing each and every one. And thank you for the messages, the encouragement, and truly inspired me to continue doing the work that I believe also the Father has given me. And really greeting you all in the name of the Almighty Yahweh for tonight. Indeed, it's cold in here in Canada, but indeed, the Father has been very good to us, delivering us in everything, all sickness, all harm, and really and truly, indeed, presenting again to you today. And thank you for joining me. No matter how hectic our schedule is, your schedule is, time spent with the family, indeed, I really appreciate you joining me. To those who are watching live in Facebook, I truly greeting you all, blessing you in the mighty name of Yahweh, and that uh, it, indeed it may be well also with you, and may Yahweh bless you and keep you. So tonight's topic, I want to present the part two of the presentation that we had three sessions ago. And to recapitulate, it's on the do's and don'ts of over-the-counter and prescription medicines. So again, yours truly, Juliet Allan. I'm a registered nurse specializing in cardiology, cardiac nursing, cardiac health, and really it's amazing to be in this career and the experiences that has seen me through. It's been hard and have immensely blessed me. And truly, I want to just take this honor to present to you something that uh, hopefully and in my prayers that also bless you. So last time, to recapitulate of what we talked about, we mentioned that there are three or four vulnerable people or patients that can harm or predispose to risks of using medications. Sometimes I use drugs that really just pertaining to the medications that we use. So I mentioned before, these are the very young, especially the babies and toddlers, the very old, the elderlies, so the very sick as well, those who have compromised in health and suffering from other comorbidities that make them really um, very sick in some ways. And also the fourth one are the pregnant and nursing mothers. So I mentioned before that they're of high risk and put caution on using over the counter, even only like as simple as pain reliever or cough medicines, still have side effects that may predispose to harm. So also to recall, there are three types of drug interactions. Those are the drug nutrient interactions, as I've said, those that medications that interacts with our food, our drinks or beverages, or supplements that we are consuming. Also, another interaction is the drug to disease interaction. That is, the drug interacts with another disease or comorbidities the person has. Also, the drug to drug interaction, which means that a drug interacts with another drug that can predispose to harm or can also lead to cure or treatment. So I mentioned before, specifically the drug to drug interaction, since we're dealing with over the counter, and these are like have active medical ingredients that we need to be cautious of or need to be watchful of. So under this category, we have also three um, ways that these drugs interacts towards each other. I mentioned that alteration, intensification, and opposition. So alteration, again, to recap, this is to modify the concentration of the drug between two drugs or between three or more drugs. Intensification is means that it duplicates or strengthens the effect of a drug. For example, when two drugs with the same effect are taken, side effects may be intensified. Another type of drug-drug interaction is opposition. It is reducing or even counteracting the effectiveness of the drug. For example, two drugs with opposing actions can interact, thereby reducing the effectiveness of one or both. So those are the types of drug-to-drug interaction. Since tonight I would like to present to you most common prescribed drugs and most commonly medications that your doctors prescribe to treat hypertension or high blood pressure, diabetes, high blood sugar, cholesterol, increased cholesterol in the blood, and those are most commonly used, and also acid reflux or heartburn. And in research that found out that those are most commonly used medications at this time. And really, the purpose of this presentation is to make you aware or make us aware of the medications that we are taking. And as much as I would like to encourage a medication-free living, I cannot really say that you should get rid of your medications, but to be aware of the things that it can affect the body therapeutically or non-therapeutically, and also how it affects our functioning. Also, I would like to emphasize that when we're done, ultimately, all, use up all we can to prevent sickness and disease, like, use all like non-invasive or non-medicinal treatment or management, I could say, not treatment, to prevent illness or sickness, then sometimes we may need to see a practitioner, conventional medicine practitioner to guide us and direct us to like sound management for what we are experiencing. So again, I'd like to also emphasize that a decision at the end of the day, a decision we have to make. Um, but at the same time, what gives us peace of mind? What gives us joy and happiness, and believe that what we choose to do to treat ourselves or to help ourselves alleviate some sickness or diseases or disabilities, are we um, really happy on that decision? So in our mentation, our state of mind, that we are happy of our choices, it helps us go through that healing inwardly. And I believe that if we don't believe, well, that our choice does not help us cure or prevent illness, then it would be hard to really see the effects of what our choices are. So I believe that before we get rid of our medications as well, if we decide to stop them, then I encourage that not to abruptly and consult the practitioners, seek some advice, and also this is a major decision ourselves that we have to bring it to the Father. And truly, on our meditations and our decisions has to be guided what um, we present to the Father, and our prayers that will see us through. So again, this is for me to um, be able to help you, or also share, not to making a decision for you, but to help you and assist you in a decision, wise decision that you take pertaining to use of these medicines. And truly, um, I could say that these are temporary relief. It's not truly an end cure or treatment. It may not be um, um, end resort of anything that we go through, but indeed that we have peace of mind and help ourselves to heal itself. Last week I present something that about our decision to make well ourselves, to speak healing to ourselves and speak life to ourselves and to others. And that also, I believe that making in that decision is to guide and also to seek inwardly and spiritually what the Father is saying to us, and that it also will see us through what we're going through. So tonight, I'll just want to present some of the most common prescribed medications and their uses and side effects that probably haven't you been fully aware of those medications, and are we just leaning towards what our practitioner, our medical um, health professionals advising us to do or prescribe us to for us to take. So at the end of the presentation, also I will probably will have time to entertain questions, and I'll try to answer them. Otherwise, at the end of the presentation, you can email us also or send a message in the platform. So tonight I want to present some prescribed medications and the major classifications of those most commonly used and their side of used medications and their side effects. So first classifications are those blood pressure medications, those that lowers blood pressures that you probably most of you familiar with, or a family member using. If it's not your own medications, then you should be. aware of what it does to your body. So again, those blood pressure lowering agents, this can be classified in different types also. So in this, there diuretics, which are medications or blood pressure lowering agents that help us to remove extra fluids from our bodies. And so it helps us eliminate fluids and also salt. And the examples of these medications are Lasix, Diarrhea, Bumex, those things that make us pee, also HTZ, those hydrochlorothiazides, as they say. You probably will be is familiar with that, which make us pee or have our frequent trips to the bathroom, and that is the side effect, and that lowers our blood pressure by removing extra fluids or extra um, volume in our blood to reduce the blood pressure. Also, the side effects of these medications over time can be dizziness, as I said, frequent urination. You may tend to lose some electrolytes, also like calcium, potassium, magnesium. That will also contribute to other side effects, which are thirst, muscle cramps, also weakness, and over time, sometimes if we're depleted with fluids, it can make us constipated as well, or it can really lowers our blood pressure over time. Also, there can be variations in blood levels, especially electrolytes, as I mentioned earlier. Low potassium, depletion of potassium and magnesium, most common electrolytes in using diuretics. And also, it affects other body functioning like tiredness, fogginess, and decreased concentration, all those things when they are used over time, and we're not being mindful of its use. So we have to be sensitive and know our bodies and know when to report when we experience such symptoms. So it can be that we are overusing this medication and it tend to react, or we respond to the medication faster than or more intense than things. So the practitioner needs to know for him to adjust the dosage so that it's not overloading us with uh, fluids, electrolytes, and such things. So other classifications also are beta blockers. These are medications that acts directly to the heart. I know it's a very complex word, but they tend to reduce heart rate, slow down our heart rate, and also slow down or weaken or soften the force of the pumping of the heart and reduce the blood volume also. So examples of this are bisoprolol, Zibeta, uh, or Zibeta, Luprasor, Inderal, Tenormin, Corgard, and some other medications. And really, there are lots of medications. It's a million to billion dollar business in pharmaceutical, and really, we have to really know and be aware of what we put in our system. So side effects of these medications are lightheadedness, because it tend to slow down the heart rate, it tend to slow down the pumping force of the heart, and can result to also dizziness when we find that we change our position or get up abruptly, tend to drop our blood pressure and we become dizzy and unstable. So just a risk or a warning for a risk for fall. So we don't want to have those accidents when it's not necessary. Also, insomnia or unsleepiness. So we talked about in the past, it tend to also keep us awake, maybe due to also frequent urination or also our reducing heart rate, those things. Also, other side effects that we may need to aware of is diarrhea. So anything also it can affect our gastrointestinal system and may cause diarrhea. Also, joint pains. So we may feel achy and painful in our joints. That may be caused by taking all these antihypertensive medications. Also, another classification for or blood pressure lowering medications are the so-called ACE inhibitors. So these are medications that impedes the release of hormone angiotensin. This is the angiotensin hormone that is um, released in the system inhibits the narrowing of the vessels, thereby relaxing our blood vessels. So when our blood vessels are relaxed, our blood pressure tend to drop or lower or decrease. So examples of these medications are Capoten, Lotensin, Vasotec, Captopril, Altase, Acupril, Atacand, and Avapro, and so many more. Side effects, common side effects of these ones are again dizziness. So really, when your blood pressure drops, definitely become lightheaded and dizzy. Also, coughing, headache, um, fatigue, drowsiness, nausea, sinusitis. So some also respiratory symptoms, bronchitis, and also shortness of breath. Um, Scientifically, we could go through down the road or the physiology or the motor mechanism of these medications affecting our systems. But to cut that short, I'm just presenting the major symptoms that you need to look out when using these medications. And also, you probably have other symptoms that you notice or change on your body, what you experience when using these medications. So you can share them down the road or come to the platform and on the on Facebook page, you will see the Zoom ID where you can come and join and give your comments and share your experiences on these medications. So examples of this, another classification are the calcium channel blockers. So the calcium, as we all know, it increases the strength and force. So it has a very important role in the heart. So it gives a strength. It helps the heart to have that strength and force or contraction when it pumping the blood and also towards the vessels and away from the body. So blocking its entry relaxes blood vessels and thereby reducing heart rate and also reducing blood pressure. Examples of these medications are Norvasc, maybe you're familiar with them, cardizem, Adalat, Tyzac, or Isoptine, and many more medications under these categories. So truly, sometimes calcium help us either increase the strength of these medications also. So their affectation or their effects have complex other functions that it creates or effects that it creates in the body. So these examples have most common side effects um, that includes, again, dizziness, swelling of the feet and legs, or other like the hands or the face. So this can affect um, experience this symptom. Also, flashing, headaches, heartburns, also nausea, muscle cramps, nervousness also. So it also affects our nervous system. Again, cough, and also you may experience palpitations. So these are the most common classifications, and there are more. And maybe down the road we can discuss further this. I just want to present to you those most common prescribed medications that we are using. And so I encourage you to share other experience you may have or other medications a question you may need to raise so that we can address them to the best of my ability. So the next commonly used medications are the diabetic medications or anti-diabetic meds, also called hypoglycemic meds. They can be tablets or in tablets form. Also, they can be on in the form of injections like insulins or glucagon. So really, these medications geared toward lowering our blood sugar level, I could say, but over time need to be cautious and need to be the health practitioner may need to do blood works from time to time to check on your kidney functions, liver functions, and also other components of the blood need to be checked. The efficacy, or also if there's any abnormalities that need these medications to be stopped or adjusted. So examples of this anti-diabetic medications are metformin, really very popular, linagliptin, sitagliptin, glyburide, glipizide, repaglinide, acarbose. So these are some medications that probably some of you are familiar with, and really most common medications to lower blood sugar. So use caution of this side effects, first of all, of these medications, as I said, to lower blood sugar. It can have metallic taste in the mouth. You can have a mild loss of appetite, nausea also, and abdominal discomfort. Also can also cause diarrhea. So just be caution of and made aware when you're using this medication, especially if it's a new diagnosed illness or sickness. Then you may need to inquire a lot, ask a lot of questions regarding these medications, about their chronic use or long-term use. Truly, it affects the major organs when they're being detoxified and eliminated in the body, especially the major organs, liver and kidneys, also the pancreas involved in the release of insulin. So all those things need to be really monitored from time to time when we choose to start um, taking medications of some sort. And truly, I reiterate before that if we can alter our diet or we choose to really live a healthy lifestyle, these are next resort we have. If we done all or exhaust all our um, natural remedies, also our preventative measures, um, those are what I encourage more. Because truly, whatever we put in our bodies, it needs to be detoxified, and it needs the liver and the major organs to function to really detoxify all these toxic wastes, and it can be very risky and detrimental. So let's go back. Another classification for lowering the blood sugar when we don't have enough insulin or we don't secrete enough insulin, then we tend to be prescribed with insulin. So these are even children started to become dependent with insulin. Those diabetes that was diagnosed from childhood or teenage years, they become dependent to insulin, and it's uh, really it has some really chronic and detrimental effects of them use. So we have to choose wisely and make a decision. Um, so again, mm, there are types of insulins. They are short acting that can lower the blood sugar at a short test time. Also, a long acting that we can take, and then it will stay in our system for hours, that keep our blood sugar steady and within limits. Also, there are other classification of medicine, prescribed medicines that also are mostly used, and these are medications that lowers cholesterol levels in our bodies. And these medications need to be monitored, or the cholesterol, our cholesterol, need to be monitored to prevent heart attacks and stroke. So example of these medications are Lipitor, Crestor, Pravastatin, and other else. These are just um, most common meds, and there are other else. Side effects of these medications also are constipation, diarrhea, fatigue, bloating, heartburn, headaches, and also mild muscle pains. So these are cholesterol lowering agents, and that again, your medical practitioner need to be keep checking also your blood um, cholesterol level from time to time. Other medication classifications are the thyroid medications, the anti-hypothyroid or anti-hyperthyroid. These are examples of them are levothyroxine, Synthroid, Euthyrox, Levoxil. So these are medications that aids in our thyroid functioning, and it really have help us to um, develop or function better when it comes to our digestion, our ability to do things, our energy levels. So those things. Um, so side effects, we know like weight gain, lose weight also, loss of appetite, um, also diaphoresis, clamminess, and all those things can affect our side effects of the thyroid medications. Also, I have present or listed some do's and don'ts of use of these prescribed medications. So those medications are just most common medications that I was able to pull out and listed for you. And the rest, maybe you could send us comments and suggestions and also questions on your experiences. Again, we are welcoming those questions. So those of prescribed medication. So first, um, one is I could say that we have to adhere and to ask pharmacists any question pertaining our medications, especially if we start using them, its side effects and everything that are warning signs that we need to look out for. Also, this medication should be stored as they are directed, sometimes, most of the time in a dry, cool place or room temperature or below 30 degrees. Other medications may need to be put in refrigeration. Also, tend to have that stored in very cool uh, place to have that efficacy at the maximal level. Also, when using antibiotics, for example, as your course plan or treatment plan with your doctor, you have to adhere to that or comply to that plan. We cannot just start it and finish it after a few days and we haven't completed that 7 or 10 days that as prescribed. Always buy medications from reliable stores. Watch out for counterfeit medication. So some countries really, as I've said, the pharmaceutical business is a huge industry, and really there are fake counterfeit medications that out there, and it just not good to fall on those things. So we need sometimes to investigate where's that source or stick to one reliable store. So store meds in a safe place, keep it out of reach of children, and these are very harmful to them, and really we need to, as much as possible, maybe we need to store them in the locked cupboards or high cupboards or containers that are locked and not easily opened. Also, always carry a list of medications wherever you go that contains all the dosing and the frequencies, how often you use them. So if you tend to forget, you have a reference. And so if you're accessing a health um, facility, then you have them handy. Also, any reactions or allergic reaction, we may need to report them so that the next time our doctors or health practitioners or pharmacists are aware of those reactions. Tell your doctor or your pharmacist if you are pregnant or you're planning to get pregnant, and also if you are nursing or breastfeeding. So ultimately, take medications exactly as prescribed. Check if certain meds needed to be taken in an empty stomach or with food, or can be taken safely with alcohol, or don't take alcohol at all. Also, take medication as you remember. If you forget to take them on time, and you may need to take them as soon as you remember them, and you may need to seek advice when to take the next dose. All right, so those are do's And in the past presentation, if you probably can recall, I also mentioned a few of them. These are just some other helpful tips as well that we may um, need to adhere to maintain the efficacy of these medications that we are taking. There are also don'ts that I was able to pull out as uh, a precaution or a caution in taking prescribed medications. First of all, do not share medication with others, or do not share your medication to others. So do not use someone else's medication and give them to somebody else. Or we tend to, your medication is tend to be personalized accordingly from your health practitioner for your own treatment or personalized management to cure your own illness. Also, do not remove medications from their original containers. The containers, as I've mentioned in the past, must be properly labeled with all the dosage and how often you take them and what are the contents on that medication. So do not remove them from, do not take them out from its original container and put them to an empty and non-labeled containers. Just don't remove them, that's all. Carry the whole bottle if you may, but please don't take a few and put them in another and mix them with other medications. And you may know them, but if that there's some reason that it can be really confusing if you become, if you there's some state that you can't remember them, and that would be very confusing and very risky. Also, do not store different kind of pills all together in one container. I have a friend, or I know somebody, um, I mean, they're just by themselves in a house, a couple, and nobody else, no small kids, and nobody else live in the house, so they know what they have, and they're comfortable on mixing all these medications in a candy bowl and just lying on the table and like, no, 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 it's a big no, and truly it's scary. Do not take any medications like over-the-counter prescribed medications along with your current medications. So consult first your physician uh, if it's safe to do so. Also, do not miss any dose. Do not stockpile unused medicines at home. So once you are finished a course of that medication, take any left over to the closest pharmacy or to the pharmacy that you use for safe destruction. Do not flush them either in the sink or toilet. Do not change your medication dose or schedule. So I knew people who tend to cut their pills in half if they're feeling well, or double their dose or add their doses when they don't feel well. And truly, you have to take the same dose, the same time of the day as prescribed. And it is risky to just play around cutting doses or doubling doses. And for example, antihypertensive medications or heart rate medications or cholesterol medications, they are have to be taken as prescribed. There are research that it can double the risk of stroke or heart attacks when we tend to skip doses or change dose ourselves. So just FYI on that, you can research on it and read additional um, investigation pertaining to that. Also, as I've said, um, also when anti-diabetic or diabetic medications or insulins, you tend to add more when you eat more, or patients tend to reduce the dose when they don't want to eat. So apparently, um, um, we tend to, they have their own self-monitoring device pertaining to their blood sugar level, and so it just need to just pay more attention to that in managing our diabetes, our cholesterol level, and blood pressure, and our heart um, rate. Don't crash or break any tablets or capsules unless your doctor or pharmacist told you to do so. And some have coating in those medications tend to um, really have to be taken in and reach the stomach for it to be effective. So thereby they cannot be crushed or cut unless um, the doctor advised to do so. Don't use medication that passed its expiry date. As we mentioned in the past, don't lie down right away after taking medications too. Just making sure that the medications already reach the stomach and start um, breaking down to have its effectiveness or its use takes effect. Also, you may need to quit smoking. That your medications may be effective, especially those medications that control blood pressure, heart rate, all such. The nicotine tend to have an effect on regulating or effect in our blood pressure and heart rates. Also, most of the medication I mentioned, some side effects is drowsiness. So please never drive or operate machineries if there is any side effects of drowsiness, to keep you safe and also to just avoid the harm or accidents. Okay, last one, never discontinue medications even if you are better. So one can develop antibiotic resistant bacteria. For example, when you're prescribed with antibiotics, it's very rampant now. Hospitals developing antibiotic resistant bacteria in the gut. So we may need to, after a course of antibiotic, we may need to use probiotics or good bacteria to replace those good bacteria in the stomach that has been destroyed with the use of antibiotics. They can be replaced by organisms that is very detrimental, where antibiotics doesn't really is as effective anymore as they used to. So it's risky to develop those resistance to antibiotics. So those are the major things I wanted to extend tonight. And again, I really would love to hear from you. And thank you for spending time with me. Thank you so much for allowing me to reach out to you. And thank you for all your comments. I really appreciate messages that are coming to me. And truly, I um, love to share what I have or what I know. And it's a blessing to really be here and able to extend and reach out to you at this time, as difficult as may be, in good times and bad times. Let us stay healthy, help each other, and comfort each other. at this time, and just encouraging each other to uh, just be grateful and be thankful of what we have, and just nurture this body. No one else can do for us but us, and make that decisions to be really at peace inside and outside, healthy, strong, and really the Almighty did not give us a power of or the spirit of fear, but of power, of love, and a sound mind. So be at peace. Shalom. I love you all. Thank you so much. Be blessed. You and your houses, your families may extend all throughout to our children, to our next generations, and help us uh, take care of these bodies, and so we may live to enjoy and see the goodness and the fruit of our labors. So really appreciate your presence. Thank you so much. And again, thank you for to Yahweh for allowing us this opportunity. Thank you for Yahweh's Kingdom Lifestyle Ministry. And truly, it's a blessing to be with you all. Thank you so much. Um, I may need to really just call it a night, call it a day wherever you may be. Enjoy your night, enjoy your rest, enjoy your day, and truly, it's wonderful to being here. Thank you so much, and shalom. Also, be blessed.